And can you hear me okay? Last time microphone wasn't that good. So you can hear me. So I'll start with a quick intro. This was like intended to be for you to say hi to Kevin while waiting, and I guess metaphor blue pill, red pill, because I know you're gonna like what you're gonna hear from Kevin in the healthcare IT space. So I hope this is gonna whet your appetite for the field, this meetup. About user group itself, like we started almost 4 years ago as a regular backend developers function as a service, but over the years we realized that serverless is about agility and the mindset, and we observed that there is a gap between IT, what IT is doing, and kind of business needs. We are way too often our car mechanics keeping our cars instead of driving business on the road. And we are trying to address this gap through these meetups, like this Lego pieces teaching you about different technologies you can use, like serverless services, managed services, and everything is recorded on YouTube, serverlesstoronto.org. And because the change in IT happens from the top down, we recommend often books for the executives, how to run projects more agile. We also offer a free opinion, like either through the meetups, the Q&As at the end, or offline through the Slack channel. And a number of us are consultants. We offer consulting services as well. When COVID just started, we were offering helping people find work, but that's no longer needed. And then if you do the form survey, I'll post the link, you will be eligible to Rin Manning Publishing book title because they are our sponsors through these meetups. And I hope this is not the first and last time you're visiting us. We have a number of meetups already planned for the year. Like the next one will be on MLOps topics. I believe that Google did it right, and we're lucky to have the experts that worked on the Vertex AI documentation to talk about it next month. Then Christmas is coming. December will be like your Christmas gift, because Felipe Hoppa is one of the rare gurus that he comes from a BigQuery world, but he's now with Snowflake, so he understands the best cloud data warehouses really good, and he's explained his journey and teach you about Snowflake. So that's going to be awesome. Every year, traditionally, we do Amazon reInvent recaps. However, because meetups are now online, most of these events look alike. So you watch one, you don't need to watch everybody else because they talk the same. So James Bezic, this time, he's going to do something special. He's not going to just cover reInvent announcements from Amazon, but he's going to give a little tutorial or workshop, something to get people who are not still in serverless motivated to play with the technologies. And then a number of meetups are motivated with things I see at work. Recently we started adopting Looker, and that's such an amazing visualization platform. And Google has scooped Looker in 2019, 2020, they incorporated. So I was lucky to meet former developer advocate from Looker, Leah, who is now developer advocate for Google and BigQuery. So it's hard to find somebody who knows both technologies. So she will show you on the retail examples architecture how to use both technologies. So I will share the links here. All the meetups are hyperlinked, so you will be able to attend it and prepare. You don't have to wait until February for her. She will be talking about this architecture at the next Google Next conference. If you have a talk, please reach to John and me. A stage is open for you as long as you're not pitching, but sharing something to make this world a better place. And then please rate us and tell others about us. And so hope to see you around. So. About this specific topic, I know you're going to like the topic. You're wondering why healthcare IT, but so we often use the serverless Lego pieces metaphor. In one of the tutorials about from Dev Days conferences about FHIR, Simone Hackman is using the Lego metaphor as well. And if you look at these Lego pieces, how they're laid out, they are like the spec that the FHIR specification that Kevin is going to talk about is laid out. They go a step further than we do. They have manuals, implementation guides, to help you build something so it looks more like a house, not like a pile of Legos. So that's my kind of introduction why healthcare IT. So Kevin, I'm lucky to have met you. Before I met Kevin, it took me weeks to learn what he's going to teach you in an hour. So you're in for a treat. Thank you, Kevin, and please take it away.
Excellent. Well, thanks for the introduction, Daniel. It's great to be here, and let me see if I can now share this window again here. So you should be seeing a web page at notion.patient.dev. So I'm Kevin Maloy. So I do two things. One is I do emergency medicine, so I'm board certified. I practice in the US in DC, And I also am like a quasi software engineer. Like I'm not formally trained in or have a computer science background, but I've just always been into technology and creating things. So I kind of fell into this FHIR thing a little while back. And the thing that strikes me about healthcare nowadays is that there's an immense opportunity to just create new things because EHRs themselves are becoming API-ified, right? Like if you look at Epic or Cerner and even Meditech, these EHRs now are offering APIs that patients can use, providers can use, and they can use them within the EHR themselves. Like if you go, you can actually embed these applications that use these APIs inside of an EHR, or you can have them be used outside of EHRs. So when I was looking, I guess, the healthcare APIs, which nowadays a lot of people are using FHIR, that Lego brick lets you create a lot of really awesome and interesting experiences. So I set about trying to learn more of this myself and started putting together some videos at patient.dev for other people who were learning, just to kind of share some of the information. I think it's a really interesting time because, every software developer, software engineer has a special skill set with data, using data and code to make, some new algorithm or some visual display or to transfer data around. These same skill sets that you already know as a developer, be it HTML, JavaScript, Python, whatever, you can actually use those to affect your own healthcare nowadays, right? You can create apps that link to your own medical record, or you can create apps that link to a friend's medical record, that a friend can actually log into their medical record and use your app to view their data differently and find new insights into their health. And the cool thing about healthcare is like every software engineer is a patient at some point, right? Because we're all human. So we all have some experience with the subject matter behind it, and we all have touch points throughout the system. And FHIR nowadays lets you connect to that data that is out there about you, at least in the US. So I'll have to say I do a lot of stuff in the US. I'm not like really fluent in what's happening in Canada. But I did notice that there is like a little FHIR North meetup that's happening mid-month, and it might be worthwhile if you're into this, checking that out as well. So if you're like a software engineer and you're just approaching this and you're like how do you even get started with Smart on FHIR? And I don't even know what Smart or FHIR means. This talk is for you. Basically, what we're going to do is do some background on Smart on FHIR, and then we're going to actually make an app. So I am like a JavaScript, HTML type person. So we're going to make a really simple app on something called REPL, which is basically like kind of like a GitHub thing, but it spins up a little server type thing for you. So you have somewhere to serve out your code. And then we're going to register the app at code.cerner.com. If you don't know electronic health records, like the big ones are like Epic, Cerner, Allscripts, Meditech. So we're going to actually register an app in a sandbox inside of Cerner, which is one of the big electronic health record companies. I was thinking of doing Epic, but Epic Sandbox is actually down today. They're like upgrading it. So, but that's the plan for today. I can stop here. Any questions so far?
I was thinking maybe questions at the end. So
At the end?
This looks okay for the recording, but take the notes, please, and we can stay longer even if you have to go to your kids.
Okay. Save your questions for the end then. All right. So we'll start with some background in Smart FHIR. And if you're thinking about Smart FHIR, you're probably confused like the first time you saw it. And like, it's really not confusing at all. It's basically OAuth 2 with REST, right? And it has access points for patients and providers. And those are a little different for patients versus a provider, right? Which makes sense because patients should only be able to access their own data and providers can access like a population of data, right? So when I think of Smart FHIR, I think of OAuth 2 and REST, right? if you're going and trying to learn this stuff and you type FHIR in Google, you get HL7's website usually, which Daniel showed right here. And like, if you go here and you're like, first time here, developer's introduction. Okay. And then we got a bunch of stuff here that isn't very like inviting to read. It's a REST API. Some of this is kind of a little like hard to like dig into, and like, you're like, okay, I can read about this, but the way I learn best is by doing solving an actual problem. So that's what we're going to do in making this app. So to give some background, FHIR, SMART actually stands for Substitutable Medical Apps, Reusable Technology. Basically, back in 2009, people at Boston Children's Hospital put out this paper in New England Journal saying like, hey, should be able to have apps that work in every EHR, right? They should be substitutable medical apps right here. And it shouldn't matter if you're in Epic or if you're in Cerner or if you're in Allscripts or whatnot. It should work in all of them because, it's like 2000, it's almost 2010. This is 2009. We got all these APIs and stuff, like what's the big deal, right? So when you hear smart FHIR, the smart part is like, how do you make these apps that can work in any electronic health record? FHIR stands for Fast Healthcare Interoperability Resources. So with real world experience, you'll realize they're not as fast as you want them to be. They are about healthcare. They do deal with interoperability, which is like, how do you represent the same thing in Epic as in Cerner? And they are resources and they are REST APIs essentially. The FHIR spec, you could have like WebSockets and stuff like that. But like for all intents and purposes, for like what is available now, you just think of them as REST APIs. If you're probably thinking to yourself, there's probably not a lot of this stuff going on. You could actually check out the specs at fhir.cerner.com, and they have something called Millennium, which is like their database. But if you go up here to Millennium and you click on R4, which is the 4th release of FHIR, you'll see that there's a bunch of stuff you can get out of FHIR and Cerner. You can get allergies, you can get conditions like history of diabetes, procedures like had a cardiac cath, observations like vitals, lab tests, medication requests, which is like prescriptions, meds ordered while you're in the hospital, immunizations like COVID vaccines, Tdaps, tetanus, all that type of stuff. So there's actually a whole lot that you can get out of FHIR in Cerner. These are all live in production for Cerner. If you want to look at Epic, fhir.epic.com, you can look at their resources, and they have pretty much the same stuff, if not more. They have condition, what was it, allergies, condition, diagnostic report like X-ray reads, CT reads, document reference like clinical notes, history and physicals, discharge summaries, all that type of stuff. So I show you those two to just underscore that, hey, this smart FHIR stuff, there's OAuth 2 with REST API that patients can access, and you can make provider apps with. Actually, it has a lot of stuff in it already, even though it's fairly new. I just leave this here, Smart Health IT, as like a reference. These are the people who invented SMART. They have a little nice diagram about how they've been doing it over time, when it started in 2009 all the way up to 2020. When apparently the first APIs for the 21st Century Cures Act were implemented, were the final rule. So I will say one of the differences between Canada and the States is that in the States, there's a law called 21st Century Cures Act. And to understand some of Smart FHIR and why it's even there, you got to understand 21st Century Cures Act, which was basically the last law Obama signed in when he was in office. So this is like pre-COVID, pre-Trump, all that stuff, right? There was basically this law that said, hey, if you're going to be a certified electronic health record in the US, you got to have APIs and you got to make them available for patients for free. That's essentially what Cures Act did. That was the last thing Obama signed in, and it took until 2020 to actually make all the rules and regs about it, such that now it's actually final, maybe about 6 months ago. So it took a long time, but you're actually seeing this stuff starting to emerge in the ecosystem, which is what you see at FHIR.Cerner.com, FHIR.Epic.com. If it's confusing to you when you hear Smart FHIR, just think of it as, hey, it's OAuth 2 and REST. Now you're here like, is this ready for prime time? Once again, if you look at open.epic.com, and I left the link in the Notion there, you could be like, no one's really doing this. Like, maybe this is just some kind of theory. And like, HL7, didn't they have like V3 and nothing really happened with that? You can actually look at open.epic.com and find all the FHIR base URLs for all the different Epic hospitals in the US. Curiously, I couldn't find one in Canada, but they're all the US hospitals and health systems on Epic appear to be here. So if you look for even really famous ones like Johns Hopkins, you can find theirs there. The Mayo, which is a really famous one, right? You can look through all these, and it's actually rather remarkable about the number of patient-facing FHIR-based URLs that you can find out there. So these are URLs that you could connect the app I'm about to make with you to. And if you're a patient there, you can sign in using patient portal username, password, and use this app we're about to create. So that is just meant to underscore that, yeah, actually it's pretty prime time now. All right, so that was a good 15 minutes on just like some background, but kind of the meat of this is we're gonna learn by doing, and we're gonna create an app. And this GIF is here to remind me what app we're making, and it's called the Have I Been Tested app. Now, kind of my observation doing emergency medicine is oftentimes somebody will come in and they'll get a bunch of blood work done, and you go and you talk to them, and you're like, oh, looked at your blood work, looks good. Maybe they're there for weakness. Maybe they come in and you're like, hey, I've been feeling really weak and I'm feeling lightheaded and dizzy and blah, blah, blah. And you do some blood work and you're like, oh, the blood work looks good. I want you to follow up with your primary doc, or you need to get admitted to the hospital or whatnot, right? I thought it would be interesting to create an app that's like, have I been tested for blank, right? So I go to the ER, they told me my blood work looked good, but did they test me for anemia? Did they test my thyroid? Did they, how would I even figure that out? So what we're going to create today is an app that is like, have I been tested for anemia? So when I went to Hopkins and they did some blood work, they said everything looked fine. I wonder, did they test for anemia? So we're going to create an app that lets you as a patient actually figure that out. So to make this app, what do we need? When you boil it down, what you really need is some code, and we're going to use HTML and JavaScript, somewhere to serve that code out of. So it could be like an S3 bucket. We're going to use REPL. The second thing you need is to register the app with the EHR vendor. So you can do it at code.cerner.com, FHIR.epic.com. We're going to use code.cerner.com. And you need some login credential, right? So you need like a patient portal username, password. The cool thing about Cerner Sandbox, or the Cerner FHIR server that has fake data that we're going to use today, they have a bunch of fake patient username and passwords that you can log in and test your apps with. So that's part of the reason we're going to use code.cerner.com. All right, so 3 things to get you, and you probably already know how to do most of these. It's just no one's walked you through it. So that's what we're going to do today. So I use something called REPL when I do these little teaching sessions. So if you go and you make an account at REPL.it, it's kind of a cool site in that when you go to my REPL here at patient dev anemia, you'll notice it's kind of like GitHub, but it's kind of like GitHub pages, but not as painful as using GitHub pages. What I mean by that is over on REPL here, they got some files, right? So we have a few files here. Have a little code editor. And then most importantly, you have this little URL that is now yours, right? So anemia.patientdev.repl.co will serve out whatever's here, right? if you try to do this on some of the FHIR tutorials, like Cerner's, they're like, go to GitHub pages, make a branch, and you just kind of get confused because how many times, some of you probably have used GitHub pages, but like you gotta like switch branches and stuff. It's just a little confusing for me. So that's why I use REPL. I don't get any money or anything from REPL. I just think it's an easy way to teach people. So what you need to do to make this app is go to REPL, have an account, and then you can fork my REPL that is at this URL right here. REPL, sometimes it'll show you a screen that has this little like play button, and you do fork, and sometimes the fork's up here. But if you do that, you essentially get this little URL that you can use, because you're going to need to tell Cerner, hey, my code lives at this URL. Right? So once you got that, you actually have the code you need, and we're going to step through that, all those files a little later. Just to show you what it does, we need to go to step 2, which is register the app. Okay. So to register the app, what you can do is go to code.cerner.com, developer, smart on FHIR, and you need to have an account. It's a free account. I don't get paid by Cerner or anything like that. I just think that their sandbox is pretty cool. They have quite a bunch of patients in it, and they have a Google Doc that I'll show you that has like what information is on those patients. Likewise, they allow you to create new information on those patients, so you can like change their name, you can add like historical diagnoses, like a history of diabetes if your app needs that. So I tend to like using their sandbox. Like Epic, there's like 2 patients, 3 patients you can use, and they have like one like observation or one lab test, but Cerner's has usually quite a lot. So so you can create a free account there. And what we're going to need to do is create an app at code.cerner.com using our REPL URL, right? So if you go to this right here, I'm already logged in as my patient.dev, and these are all kind of teaching things I do. So if you go to new app, and you got to give your app a name, such as like anemia, and then you need to tell it a launch URL. So the launch URL is already in the REPL here, and it's launch.html. So what you could do is just copy this, put this, let me see if, where did I put this in the smart launch URL as anemia or whatever your URL is /launch.html. Then you need a redirect. So after the browser does OAuth 2 and the patient signs in, it needs to plop you back to your app. So our app actually lives at that, whatever your URL is /app.html. And the app type we're going to make today is a patient app. So looking at the code console, you get a kind of an idea about Smart FHIR and what you can do, in that you can have provider apps. So you can have apps for doctors, nurses, that type of thing. You have patient apps, which patients use for themselves. You can also have system apps, which are like headless, super user name and password. So like if you have some kind of like Python script or something running in the back end and it's all headless, you can use a system app. Although like system apps, like they kind of have like super user access. So like it's really hard to get one of those approved. Client type, we're going to be a public client type because we're using JavaScript and we can't keep secrets in JavaScript. They do support confidential, which is like, you know, if you have an iOS app and you have like a key store where you could keep a secret, you could use a confidential app. Those tend to be longer lived. Like I think they you could get a token for like 3 months as opposed to a public client type where it's like 10-minute lasting token. FHIR specs, so they're different like releases of FHIR historically. Just click R4. R4 FHIR is like the backwards compatible one. So if you make something in R4 today, it'll work 5 years from now. Whereas if you use this other option, it might not work 5 years from now. We're going to require OAuth 2. There are some standard scopes, which we'll just leave all checked. And then one of the good things to understanding FHIR is that that they have in the sandbox is that they have these scopes that you got to check. So your app should only, we're going to make an app for have I been tested for anemia? And anemia is like a lab test. So we really only want to access information about labs and maybe some patient demographics. But we probably don't need to access like allergies or documents or information about that encounter or immunizations, right? So for our app, we're just going to do observations because that's where labs and vitals and live. And we're also going to access patient, which gives us patient name and like date of birth and stuff like that. About this time, people go, hey, like, why are there 2 columns? That's a little weird, especially for a patient app. What's the difference between user and patient scopes? Difference is user scopes let you look out across everything you're authorized to look out to access within the database. So an example would be a provider app, like I'm a doctor. I am able to use a user scope to look at a few different people inside of my app. As opposed to I'm just a patient, I'm just accessing my own stuff. I am locked down to just myself, right? For patient apps, patient and user is essentially the same. If you launch a provider app within an EHR, like within context of that patient, like the EHR knows that this is patient John Doe, and you ever need to only or ever going to launch when you know the patient's name and identifiers, then you just use patient scopes. User scopes are like, I am going to look up patient John Doe from a directory. So I need to be able to look across the whole database to find that patient from my user. Then you would use a user scope. So it's a little weird in that patient apps, they don't take away one of these columns because when you click patient, ideally like user scope should disappear. But if you choose it and you do it and you authorize your app to use a user scope for like observation and patient, for a patient's app, it'll just lock down to just that patient. It's not going to let you, as a patient, query your neighbor's medical record. So that is pretty much it. What you would do is click register here, and what it'll do is generate a client ID, which is like an identifier for your app, which you're going to need, and it'll be right here. And usually all the way at the bottom, you can go and click on it again, and you could get the client ID right here. So we have completed step 2, which is we're going to register our app with an EHR vendor, and we just did that, right? The Notion itself walks you through in case you forget or having problems, where you get the smart launch URI, the redirect URI, what to click, observation patient. Okay. Now the final part, what we got to do is just wire up our REPL with our client ID and our redirect, and then we can actually launch it. So what you want to do is go back to your REPL and you go to launch.html, and you're just going to copy and paste in your client ID. And then you could go up here and copy this and paste that in right there, and just keep /app.html. See here. And then what we're going to do is actually launch it. So the cool thing about REPL is there's this little tiny box with an arrow. It says open in a new tab. And this is actually the code that's running there, right? This is my index.html. So if we look at index.html, basically it's just some HTML tags, body, an anchor tag. It says we're going to go to launch.html. We're going to launch this server, FHIR server, and we want you to display some text called have you been tested for anemia? Log in here. And to give you an idea about how cool REPL is I will add like 2 little exclamation points, and then they're just like updated over there. So it's really kind of cool. But what we're going to do here is we're actually going to click here, and it's going to launch it. Now you're probably thinking to yourself, well, how am I going to use the username? No, the username and password. And in the Notion here, it says for an example patient, enter Frederick Smart with password Cerner 01. All the sign-in stuff is actually on their Google group here, and it's on this Google Doc. It's like public knowledge. It's not like I'm giving away any kind of secrets or whatnot. They actually publish all this stuff here. So there's a bunch of different patients in their sandbox, and they tell you the patient access login right there. All right. So to test this out, what we're going to do is click open a new tab, click here. And what it's going to do is say, hey, I'm trying to authorize this app with this client ID. And it's going to put you to cernerhealth.com OAuth, right? You can enter Frederick Smart and Cerner 01. And this is the patient doing it for themselves, or if you're accessing your own medical information. That says, hey, have I been tested for anemia, or whatever you called your app, to access your health information from Ability Center, which is what they're calling this hospital that this patient was at. And it says, allow access to the records of Smart Test 1, Test 2. This is actually Smart Frederick. As I mentioned earlier, they let developers change like names and stuff. So I think one of the developers who's using the sandbox changed the first and middle name. But it's going to allow have I been tested for anemia to view demographics and diagnostics, which comes populated from when we check those boxes for observation and patient. And it's going to allow access for 10 minutes. And then if you're the patient, you can allow access to your medical record to this app, or you can just go back and like not allow access. So what's going to happen here when you click is it's going to go to the redirect URI, which is app.html, and I conveniently set up a few little calls that we'll go through to get you a hematocrit result, which is the test you run for anemia, right? So it says here, you were tested for anemia at this date time, not a great formatted date time, granted. Your hematocrit was 3%, which is insanely low if anyone knows hematocrits, but this is all fake data. It says, according to Wikipedia, if you are a woman and it is less than 36, or if you're a man, it's less than 40, you were anemic at that time, right? So the question was, was I tested for anemia? I was like, yeah, you were on March 13th, 2020. So that is the app itself. Some of you may have gotten this screen, which is this little error thing. Basically, Cerner Sandbox takes like 5-10 minutes for it to actually register your app behind the scenes and your client ID to become like valid. So if you see this error screen, just try to relaunch it in like 5-10 minutes. Sometimes it just takes the server, their authorization server, a while to catch up with everything that was registered. But that is that. Normally, I would stop for questions and then go through the different files to show you what actually happened. Do you want me to just keep going, Daniel?
It's up to the audience. Are there any burning questions, or you can wait to see the magic inside? Let's finish and then we can.
Okay, cool. Yeah, so there was a lot of magic inside that happened, right? But it's all stuff if you do any web development. So there was this index.html, which redirected to launch, which just said, hey, launch this FHIR server. Inside of that code console, if I can find it again here, it'll tell you their sandbox. Let's see here. Like I didn't just kind of make up that URL there. It's actually this URL is their sandbox right here. It says our FHIR spec R4. This is their like de-identified or like fake patient data sandbox. So launch.html essentially said, hey, I want to launch this app against this URL, right? And it'll let you click and open the window, right? Launch.html, the thing that says, hey, Cerner, I'm trying to open this specific app. It uses something called FHIR Client v2. FHIR Client v2 is made by Boston Children's, the people who invented Smart FHIR. And it's basically a little JavaScript library you can put in there to kind of do the OAuth 2 heavy lifting for you. Because there's nothing worse than like trying to start doing something and then you're just trying to learn OAuth 2, right? You're like, I just want to make an app that shows me if I've been tested for anemia. and now I got to learn OAuth 2. So this smart FHIR client JS actually just helps you do the OAuth 2. And all it essentially launched essentially just has one thing in it, which is FHIR client creates something in the global scope called FHIR. OAuth 2 authorize this client ID with these scopes, and then put it back at this redirect URI. If this redirect URI does not match what you registered, it'll throw some error. So if you see some error, oftentimes your redirect URI is not what you registered. Like yours should be whatever this is up here, also down here, right? So once you go through and you go Frederick Smart and Cerner 01 and you authorize, what it's going to do is put you back at app.html. So app.html is pretty simple. It just has that FHIR client, which finishes the OAuth 2 thing and gets you an access token. It has a little jQuery in there because, you know, I grew up with jQuery and it's so hard to like migrate off jQuery. It's sad. But so, you know, it's pretty simplistic here. There's some styling, which just gives it the light gray background. There's one div that's called main. And the JavaScript is basically global called my app, just to kind of keep stuff, you know, keep the global scope not too polluted. There's this FHIR OAuth 2 when that's ready. So in here, we're like authorize. And then once that authorization is ready, then you're going to return something called client. And I put it in the global, in my global my app.smart equals client. You're probably like, what is that client? That's a good question. So you could actually just type in here, my app.smart. And this is basically the FHIR client giving you stuff back, right? The most interesting stuff it does is it gives you the patient identifier, so their ID. It gives you information about the user, which I guess in the case of a patient access app is all null because the patient is the user. So I'm guessing this is just the ID. But probably the most interesting one is this thing called state. And it has the a lot of the stuff that you already told it, like the client ID and the redirect, but it has the token in there. So your access token is actually this, right? So if you're going to make a request against the FHIR REST API, you're going to need this access token. It happens to be JWT, right? So you can put in jwt.io, and you can actually take it and, oops. Where did it go? Token response. Like I just saw it there a second ago. Did I delete it or something? Let's see, it still looks like it's authorized. State, access token. And then go over here and, right, this is like a TWT. And it actually currently has some information encoded in it, although I think most of them are moving away from actually encoding information like this in there. But it actually tells you that ID, have I been tested for anemia, the ID. So it's actually not just gobbledygook, which was like my initial impression of it, but it actually has some information in it. So once we get that back, we have the access token, and then we're going to do requests. And there's this little function called do requests. I have a little thing if you're trying to get like conditions, you could uncomment this if you put that scope in your registration when you do it. But if you're interested in that type of thing, you could just look here and see how I do it. But the one that I'm doing for anemia is basically this fetch right here. So there's a network request to the server URL / observation for patient with the patient ID this and the code of LOINCs. So you're probably like, oh, there's this array up here that says LOINC 4544-3. So it just so happens that there's this medical terminology called LOINC, which is kind of standardized for lab tests, right? So if you look up hematocrit, which is the thing for anemia, what you test for anemia, that or hemoglobin, you'll find that it is actually this LOINC code. There's actually a little helper at search.loinc. you go here and you go hemato. It actually, this site is a little overwhelming, but we could verify that this is hematocrit. Apparently hematocrit of blood by automated count. So essentially what we do here is we make a network request that says, hey, at this server URL, we want the observation on this patient ID with this code for hematocrit, right? You got to give it some headers, which is application/JSON plus FHIR, which is always interesting. You got to remember the plus FHIR. And then the authorization is a bearer token, which is this access token. And once you do that fetch and you get it back, return that data, and we turn it to JSON here. We log out the response so we can look at it. And then if there's no data in that response entry, we say we could not find you were tested for anemia. If it does find something, it just makes a little concatenation of like, hey, your hematocrit was this value in this unit, right? So if you're interested in what this actually looks like, and I think this is kind of the take-home point if you're starting with FHIR, is like, if you're interested in what FHIR is actually doing, in OAuth 2 and REST API, it essentially gives you this JSON back, which you go to entry, resource, and you'll see here that there is something called code. And this is the abbreviation for hematocrit. It'll give you the LOIN codes for hematocrit. It is a category of lab result. It was based on an order called service request, and here's the order if you need to look it up and fire it against service request to get more information on the order, like who ordered it, which encounter it was ordered on, interpretation, which this one is crit, which I imagine would be critically low because a hematocrit of 3% is actually incompatible with life. But there are some standardized ways of doing critical values, critical abnormal according to HL7 or according to Cerner itself. They have some reference ranges, like what's a normal high and low, right? So 3% is a lot lower than the low of 38%, right? Which patient it was on, the subject, which was this patient. And then the value quantity, which is the value, which was 3 in this instance, and the unit, which was 1%. So 3%. Actually, if you look at hematocrit, kind of the interesting thing about it is, you know, if I'm feeling weak, one of the things might be anemia, right? So it means you have low red blood cells. So one way of looking at that is you get a lab sample and you spin it down into plasma and red blood cells. And the percent that is these red blood cells is your hematocrit. So usually it's between, when you spin it down, it's between like 36 and 44%. So if you imagine an R fake patient here, it would be 3% here. So this is like somebody who's been shot or like just exsanguinating. You usually don't see 3% because that would mean that a majority of your blood is actually plasma. Like I doubt it would still be red at 3% because the normal is somewhere around 36 to 44. But just in case you were wondering about like, have I been tested for anemia? What we were looking for was this red blood cell count. And if you have too little, you could feel weak. Too little red blood cells and make you feel weak. So, all right. So that's what I got for today. And let's look through. Oh, I missed a lot of the chat.
You'll catch up. Thank you so much for the presentation. And I love how you started. You didn't know you know the stuff. So because this is IT group, so I just wanted to share with them like your knowledge and how easy it is for them to dive in. So thank you for that.
Yeah, and I will say, so Irna said that, yeah, you know, like Cerner is not yet available. The FHIR interface from Cerner is not yet available in Canada, unfortunately. Yeah, because I was trying to look for that. Like before this, like I'm very kind of US centric in what I've been making. And I was trying to find a good Canadian hospital FHIR URL, and I was unable to do it. And that's why I suggested this FHIR North thing, because it seems like they have a lot of people in the know going to it. And you might be able to ask them like, hey, you know, like which hospitals in Canada actually have FHIR URLs? Because this code right here on REPL, it should work regardless of the EHR, right? It should work in Epic or Cerner. You just have to register the app and change the launch.html to whatever client ID is there. Is it true that Epic is used by almost all Canadian hospitals? I don't think so, but they have a large market share. Medic, if you're looking for a CTO. Yeah, I think I was looking at the same one with the EHR vendors. I think it was like a quarter Epic, quarter Cerner, and for some reason, like the next one up is Meditech. Allscripts, MedHost, Athena. Those are the big ones. Epic has been winning more in the last few years. Yeah, I will say, like, if you look at FHIR.epic.com, they do have a lot more APIs available for FHIR. The one thing to be cognizant of when you're looking at like FHIR.epic.com, at least in the US, there's something called the US CDI, which is the Common Data for Interoperability. Access for patients to those data elements that are in US CDI are free, right? So like, where else are you going to be able to make an app for somebody and have someone else cover the cost of like providing that data, right? So the hospitals and the health systems have to bear the cost of that, of the patient access. But it's limited in scope to what it is, and it's called the US CDI, which is basically like allergies, conditions, documents, which is document reference, procedures, medication request. So if you look at FHIR.epic.com, you'll notice that there's a lot more. There's something called questionnaire. Those may not, that one's not part of US CDI, so it could be a paid API. So like you as a developer might have to pay for use of that, right? And Epic has like, you know, this whole App Orchard program where you gotta like enroll and pay something to be part of it and then pay per API call or something like that. So if you stick to like the basic stuff, which is US CDI, at least in the States, that those data elements are free for patients to access.
Since you're talking about costs, so is there any cost to certifying app? Like in Epic, you develop it, it's available to all the hospitals. In Cerner, it has to be certified. What are the costs like for small startups or?
Yeah, I saw something. So I would say if you make a patient-facing app in the United States and you just use the limited US CDI, I should probably just show you US CDI V1. It actually, oops, there it is. It has like allergies, immunizations, labs. It has a lot of stuff in it. There's no charge to use. Vital signs, demographics, problems, procedures. If you start using the paid APIs, there's like, I believe it was like code, reason I am getting like this weird, maybe it's just my wireless keyboard acting up or something. It's code.cerner.com. I have a little thing here about how to join their developer program. Epic's is notoriously expensive, but you'd have to look here. It seems to change quite frequently. Pricing for services listed above are $12,500 annually per enrolled app currently. So that's at least, I imagine it's comparable, if not more pricey in Epic. Essentially, and you said validated app for patient access in the United States, they do not have to be validated. Like you as a patient have a right of access to your own medical record through these APIs. So it's actually illegal to require certification or validation of those apps direct to patient. Now, if you're selling to like a health system, it could be different. Like it depends on what the health system is doing. But for patient apps, they're actually not subject to certification or validation. If you look on that, there was people always ask this question inside of Cerner's, where was it? Cerner's developer group here. I'm sure, sure one of the top ones is you know, how do we validate a patient app? And it's like, you don't have to. So one of the cool things about Cerner is they have this like super provider-facing apps have to go through validation, but patients don't. They have this super utilized Google group where their actual engineers are on there, right? So Yegor, who's actually more than an engineer, is on there. But you'll see that the actual people who are making this at Cerner usually respond to these, which is part of a good reason to use their developer sandbox, is because they are like super active in the community. Like there's another Cerner engineer.
That's cool. And everybody's so quiet. You can unmute the mics and ask chat to Kevin directly. Alexander was asking questions in the chat. He was raising hand. Okay. Alexander, you want to?
Do you know if Epic differentiates user versus patient scope? I believe so. So I've made some patient-facing apps in Epic, and I believe I saw that there. To me, when I look at user versus patient scopes, it's, you know, can you query across the whole database, or are you locked into one patient? So FHIR, it lets you create apps. So if your main branch point is like patient-facing apps, provider-facing apps. And if you're a provider-facing app, are you like, do you know which patient you're looking at when you do that launch.html? So if you're inside of Hyperspace in Epic and you launch your FHIR app, does it know which patient is in context? If so, use the patient scopes. If it doesn't, and you gotta like look up John Doe or Frederick Smart, the user has to look them up, then use the user scopes, is my understanding. Kind of partnership. Some of this is like Canada specific, and I don't know. I think Igor knows a little more about this. They don't share data unless they have some kind of partnership agreement directly or through a regional jurisdiction initiative. In the States, like patients can access their own data from whoever developer they want to access it through. But if you were like going directly to a hospital or whatnot, then you'd need like an agreement, right? A partnership agreement. Listed in App Orchard, and whether there was separate documentation for patient-facing apps. If you're interested in Epic, and most people are, because they're like a behemoth, I do have a make a patient-facing app in Epic, which is just a hemoglobin A1C. And one of the hard parts about this is just figuring out like, who am I gonna log in as, right? And Epic's is kind of really hard to figure it out, but I have the link somewhere in here, yeah. So Epic's test patients are actually here until they change. So these are the credentials for my chart to log into their sandbox URI, which is this URI here. But sometimes the most frustrating thing is like, how do I even log in to test this app out? So that's what I tried to do, is to put these together so that like you make a simple app and then you have like all the little different pieces that are spread out all over the place, kind of consolidated into one document. Does Epic have smart FHIR capabilities? Yeah, they do. I don't know if they're rolled out to Canada within Epic currently. I know Women's Hospital's not smart apps, does have smart apps. Okay, probably. The large CMR vendor in Canada is Meditech, and that's what I thought too. Could the lack of centralized regulations like HIPAA in Canada be a barrier for widespread adoption of FHIR? Yeah, you know, like some of the US stuff, it's based on the HIPAA right of access is part of the reason why patients can use whatever app they want. But it's also from a 21st Century Cures Act, which prohibits data blocking, which is basically like saying, oh, we don't feel like giving you your data just because we don't like your app. So there's HIPAA plus Cures Act. Hopefully I got, you know, if I skipped over one of your questions and you want to unmute, please feel free.
Don't be shy. Okay, Vikash, go ahead. Unmute. Vikash, you raised the hand.
I think you're unmuted. Let's see.
Vikash. Maybe it's a mistake.
Yeah. Yeah. Well, hopefully this was like helpful to, you know, the idea behind this is when you start doing these health apps, it's just like so overwhelming looking at the specs. Like it kind of reminds me of when I started using GCP, and you're like, how do I even authorize this API to like run against this account? And it's like, I just want to use the API. Like, please, somebody just like walk me through like all this like minutia, right? And I understand why the minutia is there, but probably the biggest barrier to creating a health app, at least in the States, is just going through all the little minutia. It's not necessarily that you don't know how to make how to interact with OAuth 2 and a REST API. The problem is you don't know which URL to go to register your app and like which username to log in as, right? Like all this stuff is just really basic like web app development is the way I see it. And it puts developers in a really cool position to make stuff for themselves, their families, for, you know, their neighbors. Like you can actually create these apps, like you have the skill set to create this stuff that can really influence people's lives. And it's all within your tool set. You may need a little help being like, hey, anemia, that's like a hematocrit, what's the LOINC for that? But like you could kind of figure that stuff out once you, that's probably like 10% of the battle, right? Like 90% of the battle is just actually being able to make that fetch or that AJAX request, or to filter through, or to create some kind of UI on top of this. And that's all stuff I think you guys know how to do. So that's why I put together patient.dev and kind of the idea of empowering developers to be healthcare's heroes, because you have the tool set. It's just like one or two other things you need to know, and you could really do something awesome.
I have a question about the auth, Kevin. You gave the example of the OAuth 2, and I understand technically how that works, and you get the bearer token and all that. But who is it that's doing the authenticating? I mean, what are the odds that Joe Public has a login and a password with a company called Cerner? I mean, they wouldn't. So how do they auth themselves somewhere else in order to get a token to look up what should be their own data?
Yeah, so you have to, so usually the username password is just the patient portal or MyChart username password, right? So you have to have a pre-existing account inside of that instance of the EHR for patient access.
Right, and each EHR vendor would have their own way of setting that up initially. Maybe you provide some sort of proof of who you are or whatever.
Yeah, usually it's like you go for a visit, like if you go to the ER and you're there for weakness and they do some blood work, usually on your discharge instruction, it'll say like register for our patient portal, right? And you could go register and create a username password. Thing is, like it's not like there's going to be a centralized username password for like all of your medical records. Like maybe you go to Hopkins and Mayo and wherever else, like you'd have a login for each of those. So, you know, if you look at stuff like like Apple Health. Apple Health, they connect to FHIR APIs. Like if you go and you open up your iPhone, if you have an iPhone, and you go to Health, and it says like connect to these health systems. You basically use your patient portal username, password, and you can consolidate all of your records into one kind of central repository on your phone. And then there's some like iOS like APIs that you can go and query that stuff and get a consolidated view. But yeah, it's a big problem, which is like, you know, you could have multiple different username passwords at multiple different systems, right? Kind of like a bank, like if you have like several banks or something, you know, like you'd have your own login there to each of those. So consolidating is problematic. But there's Health on iOS, and there's also Commons Project, which has like an Android equivalent, which is pretty cool.
What's the name of the project? Commons?
It's called like Commons Project.
Okay.
They're memorable, and they're the same people who are doing the smart cards.
Mm-hmm.
I believe they're part of the VCI, the Vaccine Credential Initiative.
Mm-hmm.
But they also have like an Android app that's similar to Health.
Cool. And folks, like you have a unique opportunity to ask a doctor anything. Like we know IT stuff, but we don't know health.
Yeah.
Like,
I got this mole. Let me see if I got this mole spot here.
I mean, for the use cases, like what are the use cases you have in mind? Like you.
Yeah.
Anything else? Any questions for Dr. Maloy?
Yeah. No, yeah, you know, like, so it's interesting, the stuff you can do, right? So you can, so some applications of this are the Vaccine Credential Initiative or the smart cards, where you can get a QR code from the FHIR server that says, hey, I am this person with this date of birth. I'll say that they got I'm the FHIR server, and I'll verify that they got this COVID shot at this date time, right? So if you look up health cards or VCI, that's all built on top of SmartFHIR, which is like, hey, I log in with my patient portal username, password. I can access immunizations resource. I can pull that back, and I can verify against the keys on that server that, hey, the server says that I've been vaccinated, right? And I can share that with whoever I want.
Go ahead, Igor.
So yeah, I wanted to mention that we are going to use VCI in Ontario, and Quebec has been already using this.
Wow.
So it's a great standard for us to use. Yeah.
That's awesome.
Yeah, for vaccine credentials, for verification of proof of vaccination. Yeah, this is what we are going to use like on October 22nd, if everything goes well.
Yeah, and it's built on top of FHIR. It's actually interesting that FHIR servers themselves are like kind of the identity of like an organization in a way to verify that, hey, you know, Hopkins is this FHIR server, or Mayo is this FHIR server, and it has this cryptological kind of these keys that you can kind of prove that, you know, it is who it says it is. So it's fascinating. There is on patient.dev there in a similar at this notion.patient.dev, I did a talk. I never got around to recording it though, on build a vaccine credentials app with smart cards in about 20 minutes. So it kind of walks you through creating one of those QR codes if you're interested in doing it. Kind of the hard part is actually having some kind of reader for the code and figuring out which like library will make a QR code for you. But it pretty rapidly goes through how to create one of those. And it's very similar, like you got to register an app, much like what we did, and give it immunization, observation, and patient. And I show you, I have some REPL there, and you can log in and get some COVID vaccination records and get it verified by this little verification app, which is at the Smart Health Card Verifier, which is kind of cool. But if you're interested in that stuff, you could just check out the notion.patient.dev, and there's a little link there for the VCI.
Thank you. That was originally the plan, to repeat the talk here because you didn't record it, but then we pivoted.
Yeah, Yeah, the QR stuff, there's enough going on with just the OAuth and the rest, and I'm like, just too much.
But this is perfect. It's going to get them motivated to go deep on their own. So basically, the next steps for those who are interested would be go through Kevin's work. Then there is Dev Days, FHIR conferences. That's overwhelming. Like there is endless years and years of recordings. So it's hard kind of to pick the right one. And so it has to be work driven. And then you mentioned this conference, North. This is the first conference. I don't know if anybody from the organizers here. I spoke to Doug today, so he generously offered $50 discount for everybody joining that conference. It wasn't expensive. Like maybe it was $125. Now you're going to get it for $50 cheaper. So,
yeah. And I saw Graham Grieve was talking there, who's
Yes,
actually the kind of godfather of FHIR. I guess if Josh Mendel was the father, Graham Grieve would be the grandfather. So it looks pretty cool.
Perfect. And then when I prepared the slide for your intro, we were covering like a patient and doctor use case, and there are B2B use cases. So like it's interesting topic because that's like where companies get the data from the hospitals at bulk. And you made a comment on LinkedIn about Epic Bulk API. Can you just kind of chit chat about B2B?
Yeah, let me see if I can find this. Yeah, so like the 50,000 foot view of FHIR is, and I saw there was a question like what problems were you able to solve with FHIR? So like the 50,000 foot view is like, you got apps that are for patients, which is kind of what we made, right? Which was, hey, I feel weak. I got some blood work done. They said it looked okay. Did they test me for anemia? And likewise, you could have many iterations of this, right? It could be test my thyroid. Did they test my kidney function, et cetera, et cetera, et cetera. So there's these really interesting patient use cases, which is patients can use an app that may not have been developed by a health system or an EHR vendor. It's just an app maybe made by a niche group like the Lupus Foundation or like Lou Gehrig's disease. Like you could make these niche apps that add a layer on top of a patient's data and make those available to patients, right? So I think those are really interesting, and it kind of goes along with the maker movement, at least in the US, where there's like a group of really highly motivated patients who have really bad illnesses, and people aren't making apps for them or trying to help them all that much manage their medical information. And one of the more interesting things you can do, at least in the States now, is empower anyone who knows web development to create apps for people like that. So there are provider apps. So if you're interested in like what problems are even out there, you go to code.cerner.com/apps. We have an app gallery of different apps these have been vetted by Cerner, but these are the types of things people are making with FHIR, right? So there's To Be Precise, which helps clinicians leverage the power of genetics and genomics within their clinical workflow, improves medication safety, right? So you can go and click in, you can learn more about that. Apparently they have some like family tree stuff here. They have something about pharmacogenomics. They probably are using, if I had to guess, like the medication request API to do that, and probably like patient and getting like an age or something like that. They might be using like observation and getting kidney function to kind of better tailor what medication should be used. I've seen some advanced directives, which are kind of interesting. I actually taught some med students at Georgetown a little selective, and I gave them we gave them $150 and the opportunity to hire somebody on Upwork to make like a little component of something they thought was interesting. And we actually, one group wanted to do advanced directives, and they're like, yeah, we just want to improve advanced directives. We feel like they're just like horrible and they're hard to read and hard to prove the authenticity of. So they actually hired a guy who made something on Stampery. So he used like the FHIR, I think it was like just patient FHIR, like the name and date of birth and stuff, but actually hashed it onto the public Bitcoin chain, like the hash So you could prove that it was actually a valid advanced directive. It was super interesting. I never used stampery before. I thought that was interesting. But, like advanced directive stuff, because these are all documents that you can surface inside of the EHR with document reference. You're seeing like telehealth integrations use FHIR. That's basically to like get like patient demographics and scheduling information out. So Amwell, which is like a publicly traded telehealth company, they have a validated app. eCare, they have digital wound. So the cool thing about FHIR is like, if you're doing web development, you realize that, hey, I could use the FHIR APIs and I can also use my own custom APIs, right? So maybe I store these 3D images of wounds that I'm taking on an iPad with a special 3D kind of camera. I could store them in my own database and I could surface them within the EHR using Smart FHIR, right? Even though, Cerner's EHR has no concept for 3D photography, right? Or even what to do with these. So this is a provider app. I think there's another wound care app in here. Let's see, appointment reminders, risk calculators, some determinants of health. This one's kind of interesting in that, like, I believe they take like the patient resource has like the patient's address. It's like what addiction and recovery resources are by that patient's address. Pretty cool. And you surface that within the EHR, so somebody just clicks and then they have a list of addiction and recovery treatment kind of personalized or tailored to that person's address. Kind of cool. But it's like, it's not like this huge thing you gotta go to medical school to make, right? You already know how to probably make that just by looking at it. Now that you know how to use Smart FHIR. Yeah, but the list just kind of keeps going on and on. They add to this very regularly. But if you want to get an idea about like provider apps, it's good to look at HealthcareIT as well as Epic's App Orchard. They have very similar listings.
Cool. You had a really good talk. How did they do it? I think it's on the same topic. So one of the talks you gave was like, that was awesome, and I can recommend to everybody to watch it.
Yeah, there's I have the next great idea for the next best medical app. Where do I start?
I love that talk.
Yeah, so I was trying to, I think this is actually an Airtable. This was when I was starting to use Airtable. Or no, this is actually Notion. But here's all the different app stores. That's right. Basically say like, how would you make a growth chart or well sheet or one record? And you got to ask like, who's it for? What change is it making? How do you enroll a patient user? How do you launch it when it's needed? So I sometimes do this with Altimetric. They have a little collider space. So periodically I'll do a talk with them on a topic. So you can watch the video there if you're interested as well.
That's awesome.
I'm curious, do any of the developers behind the provider apps, like how do they make money, or do they make money?
Yeah, that's a great question. Right? Because apparently, like I think it was 12,500 a year to be listed here, right? These people, they tend to sell directly to health systems, and they have some like, they're like maybe MCG Health is like, hey, we have this admission documentation thing that prevents denials, right? So they have some business model and they're selling directly to a health system. Kind of the unknown is like patient-facing apps. Like, how do you actually monetize those? Which is like, you can create all this awesome stuff with a patient-facing app and really enable patients to have, crazy visualizations if they wanted. But how do you fund that, right? So that is, there's always this presupposition that like, if you give people access to their data and you let like, and you open up the ecosystem inside of the EHR, that people will find a way to like monetize and create new business models and provide more value. I don't know of many direct-to-patient companies that are how they actually are doing that. There is one interesting one record, which is kind of like Apple Health, but they strike me as very similar. But they're a startup. I think they're in Baltimore. They seem to be doing okay. You might be able to learn some by looking at their site. But like patient-facing apps is like one of the who knows, right? Who knows how that's all going to turn out.
And then we have 5 more minutes before you have to leave us. Like B2B use cases, that's Wild West over there. What I've seen it work.
Yeah, so B2B, I don't recommend using that stuff. B2B integrations. So it's basically like this headless way, like you're just doing curl or whatever from, like a Lambda function or something that's just saying, hey, I already know the patient is this, just give me all their medications, right? And there's no like UI. There's something coming out called bulk FHIR, which is like you could say, hey, I have this roster of patients that was previously registered, like I'm an insurer and I need to get like all the labs or something on these patients for treatment purposes or billing purposes. I'm periodically going to call this URL and get information about this list of patients. That has not really materialized yet. In Epic, they do have, I forget exactly where it is. I did have that LinkedIn post that Daniel mentioned. I want to say it's like up here.
It was in the new announcements. They just did it in August before the HIMSS.
There is something about it.
And then it couldn't take more than 1,000 patients or something.
Yeah, so this is their bulk FHIR. And they kind of go through like good use cases and bad use cases for it, but I think it's limited to like 1,000 patients at a time, which you think of like an insurer doing this or whatnot, that wouldn't be enough, right? So it'd be interesting to see how this pans out. Most of FHIR nowadays is just like one at a time. Like I'm a patient accessing my medical records, or I'm a physician, nurse, PA, NP, accessing one person's medical information through this app one at a time. This aggregate stuff is just starting to emerge. And you'd first see it in Epic. You don't really see bulk FHIR in Cerner yet. But it's going to grow over time. All right. Well, what's that?
Sorry, I'm on mute.
Oh, you're on mute. Sorry, go ahead, Daniel.
No, any other questions? Because I know you have to go around 7.
Yeah.
So if there are no other questions, let's do the draw. Maybe Kevin, you win a book. So our sponsor is Manning Publishing, and they have books and video courses, and maybe you pick up something else than jQuery.
I know, right? So, nowadays.
So we'll do.
We're doing Lodash. I got off of.
No, it's all good. There is so much to learn, and none of us knows the business kind of side, the medical side. So this is awesome to have somebody who covers both sides of the coin. So much appreciated from my side. Jonathan, is there anything you wish we asked that we didn't?
No, I think we're all good. It was fantastic talk.
So whoever did not put their name in the forms, forms is above. You have a couple more minutes because I'm going to paste those names in the form, and then we'll see who can win Manning product.
What book are you raffling off?
Anything. So Manning was generous enough. You can take the video course, you can take the live courses like interactive, or you can take the books. So whatever you want, like it's a reasonable priced products on any topic you want. Last time we had it a little bit different because our guest wrote the book, so we were raffling her book. So okay. So let's see today's date. Oh my God, nobody. You have a really good chance. Like 6 of you didn't put their names. Who wants to do it? Okay, let's see. I'm not sharing the screen. Hang on a sec. So you start doing it and then tell me your entire screen. Share. So can you see my screen? So
It's
the
just coming up.
server,
Yep.
yeah. So the server results. Okay, we have Adam, and then who else wants to be in? Kevin. Anybody else? Or this is a really good chance to win something. Anybody else, or I can spin?
I
Spin.
think you should spin.
Let her go.
If you're not here, we're gonna spin again. Richard, are you with us?
Yep, I see his name.
Yes, yes,
That's-
I
That's
am.
perfect. That's perfect. Thank you so much. So Kevin, and we can stay if you don't have to go by yourself. I can stay here and we can chat about FHIR and international standards, local issues. But thank you so much, Kevin.
Yeah, I got to jump off because the kid's getting bedtime soon. But thanks for having me.
Thank you
appreciate
for
it.
visiting and teaching the crowd. So hope more folks are going to decide to help healthcare IT and life sciences.
Cool. Have a good night.
Thank you.
Thank you.
Have a good
Thank
night.
you. Thank you. Bye, Kevin. If you want to stay, we can continue. I can cut out this part from the recording.